All right, let's get started. All right, I am Russell Motley. I'll be your moderator tonight for this very informative and life-saving discussion brought to you by the Zeta Alpha Lambda Chapter of Alpha Phi Alpha Fraternity Incorporated, based in Fort Lauderdale, Broward County. We welcome you as we explore a very sensitive topic that continues to be debated within the African-American community: COVID-19 and vaccinations, to get vaccinated or not to get vaccinated. Tonight, we've assembled a very distinguished panel of medical experts who will provide you with some accurate information in hopes of dispelling any myths and rumors as it relates to the pandemic and all of the vaccines on the market right now. Our first panelist is Dr. William Alexis, a board-certified clinical and interventional cardiologist. He is president and owner of Florida Cardiovascular Associates. He serves as chief of the departments of medicine and cardiology at Memorial Hospital West in Pembroke Pines. Next up, Dr. Adam Berry. He was born and raised in Chicago. He is an award-winning internal medicine physician and has been living in South Florida with his family for the last 6 years. Dr. Berry is extremely passionate about educating his patients on how to become their best patient advocate while reaching their individual health goals. And rounding out our panel is Kenneth Jones, who is Chief Executive Officer of Northwest Medical Center in Margate, where he just started last month. Congratulations, Kenneth. He was previously CEO of Amita St. Francis Hospital in Evanston, Illinois. Kenneth is a recognized leader among executives in healthcare management as a fellow of the American College of Healthcare Executives. Kenneth has been married to his wife, Hope, for 16 years. They share 2 boys, Kenneth and Cooper. Okay, let's jump right in here, guys. First off, let's talk briefly about the current state of COVID-19. Dr. Alexis, we're seeing new headlines just about every day now. What's the latest? And I hope you have some good news for us.
So there is some good news, but there are some cautions as well to be taken from what's going on now. And keep in mind that I'm going to share my screen while we talk here. But keep in mind that sorry. So yeah, keep in mind that this information is changing. Can you see my screen?
We cannot see your screen as of yet.
All right, give me a moment. I'm sorry.
Okay.
All right, that should do it. How about now?
Yes, we see it now.
Okay, so ultimately, keep in mind that a lot of what we talk about are things that are really changing, from day to day. And so just a brief summary of where we are now. There are over 32 million cases of COVID-19 in the United States, more than 570,000 deaths from COVID. This is an important distinction because there's been some controversy with people talking about COVID as someone dying with COVID versus dying from COVID. People are dying from COVID. This is not over by any stretch. We all know there's been a disproportionate impact on people of color. People of color, especially Black people, are up to 3 times as likely to be hospitalized with COVID and up to 1.5 times more likely to die from COVID. But this is the not so good news. Hospitalizations and ICU admissions have been on the rise. And this time around, what we're seeing is a predominance among younger people, obviously unvaccinated because they weren't in the first eligible to receive the vaccine. And unfortunately, Broward County is a COVID-19 variant hotspot. Further, Florida is one of 9 United States and Puerto Rico that are classified as being very high risk. That's what they are describing as places where, should you get COVID, the likelihood of doing poorly is higher. Florida ranks 10th in the United States with 25.9 new daily cases per 100,000 people and has a positive test rate of 8.2%, ranking 3rd only behind Michigan and Puerto Rico. That 8.2% is an important number because the World Health Organization suggests that we really shouldn't be opening and getting back to normal until we really are below 5%. So that's actually somewhat worrisome. But the real thrust of what we'll be talking about today is the fact that the state of Florida ranks only 29th in the United States, with only 40.5% having received at least 1 vaccine dose. That's contrasted to about, say, 55% in the country. And unfortunately, the vaccination rates are declining. And I suppose we'll probably talk a little bit about why that might be.
Oh, yeah. So first off, I want to ask the panelists, I assume each of you have received your vaccinations, correct?
Yes.
All right.
Correct.
Was there any hesitancy as healthcare professionals? Was there any hesitancy on your part to get the vaccine? Be honest.
No, not.
You know, I'll be honest. I don't know that I'll call it hesitancy, but I would. It wouldn't be truthful, at least for me, to say that I wasn't in some small place a little bit concerned or a little bit, wary of a new experience, a new vaccine. But to be honest, it was the first time in my life that I ever looked forward to a vaccine. So I was enthusiastic about getting it, but I definitely understand why there would be hesitancy, as it's been called.
And I have to be honest, I was very hesitant to get the vaccine. It
Mhm.
wasn't until I saw a news story about our brother, Dr. Walter Kimbrough, president of Dillard University. And the news story was about the death of his brother who died from COVID-19. And that touched me. And I immediately reached out to him. I shot him a message telling him that because of his story, I got the Moderna shot. I was moved. And he made a plea to African Americans, don't let this be you. Don't let this be you. So Dr. Adam Berry, can you tell us, African Americans, how important is it for us to get this vaccine? And there's so much resistance.
Yeah, I mean, it's extremely important for us because, I mean, most of you guys know, or you may not know, that it's, disproportionately affecting, people of color, especially people with pre-existing conditions, high blood pressure, diabetes, obesity, all that, in a lot of our communities. And then you also add on disparities in healthcare, at least, being consistent, being compliant, all these things, lack of, just the funds to get it, all of those different factors really play in a key part. Then also, you think about the history too of vaccines, and you think about what's happened in the past, the Tuskegee experiment, all these other things, concerns that, okay, and, is this going to do more harm than good? Do I really need this? And, when you couple our hesitancy, in the past with previous vaccines, and then now, you have this new one, that hesitancy still hasn't gone away. And, despite, and that's the toughest part, despite, our efforts in explaining why the benefits outweigh the risk. And, that's the biggest thing,
And we'll talk specifically about each of the vaccines a little later, but Kenneth Jones, as an administrator, as a hospital administrator, how easy is it for folks to actually get this vaccine?
And I want to kind of circle back to your previous question. I was hesitant, and I think we have to have transparency as it relates to our own experiences. And what really caught my attention is being a healthcare leader. I think we have to lead by example, whether it be in our fraternity or in our schools or in our leadership organizations. And so, being someone in the community that's really, our community looks up to was really what was the driving factor, and being, of course, educating myself as it relates to, to what the pros and cons were. As far as access, as Dr. Alexis mentioned, Florida has really, had challenges as far as acceptance of the vaccine. I know many community centers as well as, grocery stores, we here at our facility, opened up access for those that we serve. And so I know, in our community, it's very easy to get access to, if you call up to your local community center. But, as was previously mentioned, we have to move beyond the state of hesitancy and really, continue to educate and continue to, promote, what's important for us and what's important for our communities. And so, I know early in the process, there were some challenges with our seniors getting vaccinated, but I think the capacity, some of those capacity constraints have been alleviated. And now moving forward, there is more availability in most of our communities. And so, I encourage everyone, if you have a concern, please reach out to your local health department who has access to those available appointments.
Now let's talk about who should be vaccinated. And at this point, I think, Dr. Alexis, everyone is eligible or not?
So everyone over the age of 16 right now is eligible. And that's really driven by who was studied in the various vaccine trials. So anyone over the age of 16 can receive the Pfizer vaccine. Anyone over 18 can receive the Moderna or the Johnson & Johnson vaccine.
Now, what's the difference between the Moderna vaccine, the Johnson & Johnson vaccine, and the Pfizer vaccine? Or is there a difference?
Sure, sure. So the main difference, and actually I'll do a quick screen share because I think that one of the ways to best answer that question is to understand what the vaccines do. And so, not to get into the weeds on this, but most of us have seen this diagram. I suppose you can see my pointer. And this is what the microscopic image of the coronavirus looks like, called coronavirus because these things were thought to look like crowns. These things in red are the spike proteins. And if you've been paying attention to this on the news at all, you will have seen or heard lots of talk about the spike proteins. And this is really the thing that makes the coronavirus something that can render somebody sick or even kill. These spike proteins are what gives the virus access to the cells. So in a manner of speaking, this is the pass card. Once this attaches to the cell, it allows the virus to enter the cell, to replicate itself, and to cause illness. So how do the vaccines work? So the Pfizer and the Moderna vaccine are really essentially the same. They're messenger RNA vaccines. The most frequent question we get asked about that is, that sounds a lot like genetic material, and is my genetic material being modified? No, it's not. What this messenger RNA does is it enters the cells of the muscle that it's injected into, in this case, the shoulder muscle, and it makes those cells create these spike proteins. Once the immune system sees these spike proteins, it sees them, it attacks them by forming antibodies and destroys them, but it remembers having seen them. And by virtue of remembering having seen these spike proteins before, if someone is exposed to the coronavirus, the immune system revs up and combats that virus before it can enter cells and make anyone sick. So the Moderna and the Pfizer vaccines have messenger RNA that create the spike protein. The Johnson & Johnson vaccine is on a virus that cannot replicate, cannot make you sick, cannot give you COVID, but it has the spike proteins already on it. And the immune system reacts in the same way, having seen the spike proteins.
So, Dr. Berry, this is where some of the myths come in. Can our DNA be altered by these vaccines?
Yeah, absolutely not. I mean, that's the biggest thing that that some people have concerns about. And another thing too that we will probably come up later too. Some people think that this is something that they just started in terms of making these just kind of testing these vaccines and a lot of those types of things. And this is something that's been on the works for many years, many years.
And that's one of the complaints that I've been hearing. That's one of the number one complaints that I've been hearing.
Mm-hmm.
They put this dang thing together too fast. Is how can they possibly know whether this is going to be effective, and what are the side effects? So can any one of you address that? The fact that it took them months to come up with these vaccines and actually put them in our arms.
So I can speak to that. So that's really a question I get asked very commonly. And what's happened, unfortunately, is that we've grown so accustomed to inefficiencies, to red tape, that we have bought into this notion that it actually takes years to develop these kinds of things. And in fact, it doesn't. So the first myth that really should be dispelled is that this vaccine is new technology. It's not. This is really something that was built upon more than a decade's worth of research. In fact, I'm sure many of you on this call may recall remember the virus that causes the COVID-19 is called SARS-CoV-2. There was a SARS-CoV-1, right? And that was the SARS syndrome that we were all panicked about back in 2003 that caused a lot of illness and death. And so the work on this vaccine actually began then. But strict lockdowns and I guess strokes of luck, the SARS initial pandemic went away before the vaccine ended up being necessary. So really they built upon that. The second issue that I would just quickly mention is that whereas there are phase 1, phase 2, and phase 3 clinical trials, right? Phase 1 are the trials that we do just to make sure, is this something safe? Can we go forward and test this at all in people? Phase 2 tweaks both that question as well as what kind of dosing would we want to do if we were going to put this out into the real world. And then phase 3 is, how is this working in a real world experience? What they did was, there was overlap between phase 1, phase 2, and phase 3 because there needed to be. People were dying. And so this wasn't rushed. This was just done very methodically, all hands on deck, building on previous research that had already been done.
I'm looking in the audience right now. I see a lot of distinguished people, including our district director, Gregory Harris. Thank you for joining us tonight. I want to remind everyone that the chat is open and we welcome your questions and comments. So please feel free to leave us a question and we're going to get them answered by our experts. So can our experts tell us which of the vaccines is the best, or are all of them perfectly fine?
Whichever one you have access to.
Ah.
In the short and skinny.
So where are we with Johnson & Johnson? Because obviously that was put on hold for a while, which made a lot of people very nervous because of blood clots that had been coming up. Is Johnson & Johnson back on the market now for use, or is that still on hold?
So important distinction. So it's not technically on the market. It's approved for emergency use authorization. So there's a small distinction there. But it is available again for emergency use authorization. And so what really was going on, and this is part of what may have caused this decline in vaccinations that we're seeing now, is that people got justifiably afraid, especially with the way that it was shared with the public. But in reality, what occurred at the time that they paused on the J&J vaccine was that there were 6 cases in relatively young women of a rare form of blood clots that we don't always see. But to that point, nearly 7 million people had been vaccinated. So you really were talking about something that was extraordinarily rare. And despite the fact that that was extraordinarily rare, there's no one on this call that would stop or change an activity if they were told that there was a 6 in 7 million chance of harm. They stopped and they looked carefully to make sure that there was no actual true relationship between the vaccine and these rare blood clots. Because remember, there's correlation and there's causation, as we like to say. So because they both occurred at the same time does not mean that A caused B. And so the system worked really, really well in that they looked at this very carefully and they determined that this was safe to give and returned to emergency use authorization with a warning that if someone receives the Johnson & Johnson vaccine and has unusual bruising or blood clots or something like that, these are things they should not take lightly. They should seek medical attention and tell their physician that is the vaccine they received, because how we treat a patient who we suspect may have a blood clot from that vaccine would be different from how we treat run-of-the-mill vaccine clotting.
All right, we have a question from the audience. Brother Gregory Harris wants to know, what is the difference about the 1 dose of Johnson & Johnson vaccine versus the 2 doses that come with Moderna and Pfizer?
So the difference really is in how it was studied. So if I'm understanding the question correctly, I guess the question really is, why is the Johnson & Johnson only 1 dose and the Pfizer and the Moderna 2 doses? And it's because it's how it was studied. And so the Pfizer and the Moderna vaccines were actually quite effective after 1 dose. But in the study, they found that it was even more so after a 2nd dose. And so by protocol, whenever there's something like an emergency use authorization, it's always going to be authorized in the manner that it was studied. You're not going to study it one way and then in the emergency use authorization use it another way. And so for the Johnson & Johnson vaccine, it was designed to be a single dose. It was found to be efficacious as a single dose. And so that's the reason why there's a difference in how those are done.
And to add to that, I still have a few more weeks before I have my 2nd dose of the Moderna vaccine, but I was also told by the doctor on site that I would also be required to have a booster shot maybe 6 months down the line. How does that play into this?
One thing they're looking into with the booster shots, especially with these new variants that are coming up, just to make sure, they try to, cover some of those variants as well. So that's kind of what, it's been discussed. And just, it's almost similar to, for the flu shot, when you when they try to predict which strains, for example, every year are the most common, it's almost a net, scenario. But the booster we're looking at as, more or less to, cover more for some of those variants. So that's kind of what some of the literature says.
Understood. Now, Brother Jones, when I got my vaccination, I went to Florida Memorial University where I work, and they have a vaccination site there. I was the only person in this makeshift clinic. I walked in, no lines, all by my lonesome. Is that what you're experiencing at your facility and maybe other facilities in the South Florida area?
Early on, we did have higher demands for the vaccine. Our main focus was to make sure that our, staff and the frontline caregivers that are part of the early 1A and 1B categories were getting vaccinated. And we opened up as many slots as we could and had really good success with that initial wave and those ongoing waves. And as we move forward, we noticed that, the demand really started to wane just based on more people had received their vaccines and the folks who were interested had already kind of taken advantage of it. And so we've actually, and there's more demand in the marketplace. And that's what's really exciting about where we were compared to where we were 2 or 3 months ago is the production has finally caught up with the demand. Now, unfortunately, as was described earlier, some of the demand challenges are just based on hesitancy, and some of the recent news with Johnson & Johnson probably has caused more issues. And so, from my overall healthcare perspective, I would say we thought by end of April, beginning of April, end of March, we would start to see a decrease in overall COVID cases in our facility, and it's really flatlined. We've seen a higher percentage of younger patients who are really sick, some who are being treated with advanced mechanisms like ECMO, et cetera, who are in the ICU. One of the consistent themes that we're seeing is obesity being a major factor. And so our concern is if we continue to have the trends that we're seeing around utilization of COVID in our facility, this could linger on for a while. And so I think Dr. Alexis's statistics are being, they're actually proven to be true in the healthcare perspective, in the healthcare setting, and we're seeing a lot less reduction in our overall utilization rates.
Now, I'm not a medical doctor, but I did my homework, and there's a whole term called vaccine hesitancy. Can you all talk about the adverse effect that could have on African Americans? Vaccine hesitancy.
So I can take that one. It's a very real issue, and quite honestly, it's made my days in the office a bit longer because I really don't let anybody leave the office without having a discussion about the vaccine. Obviously, it's a personal decision. I'm not interested in pressuring anybody into making a decision, but it's important that we share the information we have so that whatever decisions are made based on sound evidence. Vaccine hesitancy isn't going anywhere. And quite honestly, it's been blamed, the Tuskegee study, Henrietta Lacks, the historic maltreatment of African Americans by the American healthcare system, the US government is frequently cited, and those are all very real things. But we're also finding that there's probably more to it than even that, because when you have a group of people, for example, African Americans that are traditionally disenfranchised with respect to healthcare, in general, their access is poor. So it's really more than just not wanting to be vaccinated. In some cases, recent studies suggested that up to 30% of African Americans don't have a broadband connection, which you kind of need to make an appointment for the vaccine. The vaccine sites, African Americans were more likely to live more than a mile away from a vaccine site. Plenty of African Americans live in what we call pharmacy deserts, right? They don't have a Walgreens, they don't have a CVS. But as far as the actual hesitancy is concerned, I think the important thing is to lead by example. And I've been about as public as I could be about the fact that I was vaccinated, that I did well. I have no regrets. I would do it again. That, everyone that I care about, I've encouraged to get vaccinated, on the personal level as well as with patients. So I think that's important to, number one, recognize that the hesitancy issue is a bit more complicated than I think sometimes it gets framed as, and to make sure that we're leading by example and we're creating access.
Let's take another question from the audience. Brother Michael Robinson wants to know, what strategies must be implemented to get Black and brown people vaccinated, other than dragging them in, kicking and screaming?
I think the fact, oh, go ahead.
Go for it, Ken.
I think, having educated conversations like what we're having today, they really walks through the facts, that the facts around how the vaccine was designed, the risk of COVID versus the risk of the vaccine. The literature is very clear that if you catch COVID, your chance of having adverse outcomes is significantly higher than any risk associated with the vaccine. The side effects from the vaccine are, sore shoulder. You could, have a mild fever. Some folks get headaches. The side effects of COVID are potentially ending up on the ventilator, long-term health issues related to, respiratory challenges, et cetera. And so I think being transparent, as Dr. Alexis and Dr. Berry have really mentioned around, there is mistrust in the healthcare system. There has been mistrust in the healthcare system that really drives some of what we're experiencing today. So I think it really is going to require trusted professionals, trusted leaders, our church leaders, our community organizers, those folks at the barbershops and at the salons who lead by examples, having videotape, various members of our community getting their vaccine and rolling up their sleeves and really leading by example, because that's how we're going to really start to bend the curve and really those personal stories about loved ones that have been impacted, and how if we get more of our community vaccinated, those stories would not have to have ended the way in which they ended.
And the fact that African Americans are very slow to get this shot, to get this vaccine, how was that having an overall impact on us ending this pandemic? I mean, obviously, if more and more people get vaccinated, we can end this a lot sooner, correct?
That's absolutely correct. So, I mean, ultimately, people, the other thing that I'm sure everyone's heard about in the news, if you've been following this, is the concept of herd immunity. And the way that pandemics and the way that these kinds of infections go away is when the virus runs out of places to go. That's basically what herd immunity means. And so the experts suggest that between 75 to 80% of your population needs to be immune to the disease in order for there to be herd immunity. Again, meaning there's really nowhere new for the virus to go to create additional illness. Problem is that we're very, very far from that. And so one of the ways we try to measure herd immunity, we can use vaccination rates as a surrogate for that, right? Because people who are vaccinated, should be immune to the disease. And they're certainly immune to severe disease, which we haven't talked about yet in terms of what the vaccines do necessarily. But, the hesitancy to get vaccinated really is problematic, because the mask wearing, our, new normal, all of that, can go on forever if we're not vaccinated and if we haven't accomplished herd immunity. And so early on in the pandemic, some of you may remember that Sweden had the idea that we were just going to let this thing run its course. We're just going to have people use their own judgment. Those who want to wear masks and wear masks, and those who don't want to, they don't have to, and we'll be done with this before you know it. Well, it turns out that was a big mistake, because there were plenty of people who got coronavirus. They didn't quite get sick enough to develop antibodies, so they got sick again. There were plenty who died. Their rates of death were much higher than everybody else's. And so the reason I mention that is to really emphasize that left to our own devices without the vaccine, I don't see how we get out of this pandemic.
Wow, that's powerful. That's powerful. We have another question from the audience. Charmaine Webb wants to know, what can we do to convince young people, folks under the age of 30, that this is safe and they really need to get vaccinated? Our young folks. And again, I work on a college campus, and I'll tell you, no one on that campus was lining up to get the vaccination, and it was right there and free.
Well, one thing I definitely would say, that really sets this virus, just pandemic out, just kind of from other ones in the past is the fact that, it's so important not really thinking about yourself and protecting yourself. It's about protecting others, your loved ones, people who are immunocompromised, meaning they've got low immune system, they have autoimmune disease, maybe cancer, it could be some, lupus, something like that, and so that's kind of the biggest thing that, you really got to focus on, your family. Like for myself, I've got two, married, I've got two little ones, two toddlers. My son is almost going to be 3, and my daughter is almost going to be 1 year. And on top of that, and then my wife's an ER doctor. So, we're, during this pandemic, we were wrecked for real. Then the childcare, everything else. So there's so much going on, and a lot of times, they're still doing studies and looking at, kind of research. And somebody, I think, posted a question of, long-term, you think about long-term side effects of the vaccine, of some of these different things, and they're still studying it. But ultimately, you're looking at, okay, do the benefits of this vaccine outweigh the risk? And a few months ago, there was a report they had on CNN. It was really good, and these were like healthy, individuals or healthy Americans. Actually, one was almost like almost a marathon runner. Maybe she was African American, I believe, maybe in her 30s, still pretty young, almost better shape than both of us. And she ended up getting, catching COVID and had some kind of nerve condition with her leg where she still couldn't fully, even walking, she was having issues. This months later after she recovered. There's also been some studies of people getting COVID and, damaging part of their lung or a portion of their lung. And how long is that going to linger? Do you want to run the risk of some of these types of things happening, and for how long? And so that's kind of the biggest thing, I think, also that, really kind of put things in perspective, especially for our youth, that, what, or do you want to, roll the dice and just kind of have something rare, like, oh, I lose my sense of smell for how long? You said months, but we don't know. And so do you want to run the risk of that, or get concerned about some of the side effects of the vaccine that may occur for like a day and usually you're back? And also the fact you're minimizing the risk of contracting it and spreading to your family or loved ones who you really care about. So I think that those are just some of the things that I think it's about putting in the right perspective.
Okay, if I could, I'd like to add to that, just a quick comment, is that also, unfortunately, due to the politicization of this whole pandemic at the very beginning, there was this misconception that young people don't get this and they don't get sick and they don't die. Yeah. I can tell you for sure, I have seen young people get sick and die from this, and not just get sick and die, but suffer and die. Brother Jones mentioned, ECMO. This is basically something we use in the operating room when we're operating on hearts to divert blood completely out of the body so that the blood can be oxygenated because the lungs don't work anymore. We'd seen a 28-year-old, suffer in that manner and die. And so there's this presumption that got put out there very early in the pandemic that somehow younger people, healthier people, do not get this disease and do not get sick and die. And that's just false.
And Dr. Alexis, what about even younger kids? I'm talking about toddlers. I mean, have you seen any cases where 2 and 3 and 4-year-olds have gotten COVID-19?
Sure. So I practice adult medicine, so I don't have interaction with kids, but I know from following the topic in the news that there have been children that have gotten sick and died. Fortunately, it's not as common, but of course, it's devastating for the parents it happens to. But there's an illness that's called multi-system inflammatory syndrome that kids can develop. And once a kid who develops COVID-19 develops that, the prognosis usually is pretty poor. As far as the vaccine in children are concerned, that's ongoing study right now. It hasn't been studied in children. So children, as we mentioned before, under the age of 16 wouldn't be eligible. But everyone is vulnerable to this disease. And so for young people who get vaccinated, the other thing you're doing, in addition to protecting your loved ones and yourself from getting sick, is that you're doing your part to getting us to herd immunity.
Okay, guys, so walk us through this. So we get the vaccine, we get our arm pricked. Now what? What type of side effects can we expect? What kind of pains or aches and pains can we expect, if any?
I can tell you from personal experience, having fatigue was some of my symptoms. Just feeling kind of out of it for 12 to 24 hour period. arm soreness, but my arm soreness was no more than what I typically get from a flu shot. Those were the symptoms that I have. I've had friends that have had, mild headache, just feeling kind of out of it, where they just need to kind of relax for a day or so, and then they're kind of back to their normal activities. And so those are the symptoms based on my personal experience and folks who I know who have received the vaccine have experienced.
And of course, as medical doctors, you must say that everyone will have a different reaction or a different experience. No one person is the same, correct?
Yeah, I would agree with that. I was going to make a doctor joke and say I don't know how I'd be able to tell if I was fatigued, but quite honestly, my experience was really a sore arm. My arm was sore. I actually was fortunate. I felt nothing else. Other people have talked about headache, fatigue, muscle aches throughout, kind of just feeling like they actually had the flu, but it actually tends to be pretty short-lived.
Yeah.
So just as was said earlier, 12 to 24 hours or so.
Yeah, and then in terms of me and my wife, your doctor, we both got the Moderna vaccine. And actually, for me, I didn't get, I just got the arm soreness, just like the colleagues just discussed. But for her, it was weird. There was this, even a few of our other colleagues, I think also work in the ER, but it was like a delayed, kind of symptoms. So like 4 days out, which was really kind of like, a little odd. But she ended up getting almost like flu-like symptoms, really fatigue, all these things. But it really happened just for 1 day. And, if you asked her, would she do it all over again? And she definitely still will. It was 1 day, she was fully back to it. And it wasn't like, and that only occurred, I think, during her first dose. And her second dose, she just had, the arm soreness. So for example, even though the literature states that, the second dose, you're more, I guess, are more likely to have more of these kind of symptoms, that may not be the case, so that's one of the things you always just look at that.
Let's take another question from the audience. One of our viewers says, I've heard that the vaccine does not get rid of the virus, but makes the complications less dangerous. Is there truth to that, or is that a myth?
So I can take that. So yes, and there is truth to that. And so stated a different way, what the vaccine does is it prevents, so first of all, the vaccine does reduce the likelihood of getting COVID at all. That is well established. But the real bang for the buck with the vaccine and why we push the vaccine and the science behind the vaccine is that if someone does have what we call a breakthrough infection, meaning they get COVID despite having been vaccinated, people do not typically get sick enough to require hospitalization. They certainly don't go to an ICU. They don't end up on a ventilator, and they don't die. So when you see those numbers, when they initially started talking about the Pfizer vaccine and the Moderna vaccine, for example, and they say it was 94 or 95% effective, they're saying that that is the chances, that's how effective it is at preventing the illnesses that you care about, right? Because ultimately, none of us wants to get sick, but we all have had, flu-like symptoms. They come and they go. What we're afraid of and what made the vaccine necessary was the death toll from this. And this is sort of the illness that not only, can it can deteriorate quickly, very quickly. And so, so there is truth to that statement. You can still get COVID. You can still contract the virus, but your likelihood of transmitting it to someone else, it's been shown, is less. And your likelihood of getting severely ill or dying is actually very low.
All right, Brother Carlton Williams wants to know, is there concern that the new CDC guidelines may give the population a false sense of security, given that more people will be outside in the spring and the summer, and crowd sizes will likely increase? And first, can you preface that with what are some of the new CDC guidelines?
So, again, this is, what I'm about to say may be untrue 2 days from now, for all I know. But the most recent update from the CDC really talked specifically about vaccinated people. And what they ultimately said is that just about every activity that you would want to engage in as a vaccinated person can be engaged in safely. You can be outdoors with other vaccinated people without a mask. So ultimately, the thing that was really newsworthy about that recommendation from the CDC that came this week was that really the only time that a vaccinated person needs to wear a mask outdoors is in a crowded venue when there is expectation of being exposed to people who are either unvaccinated or unknown vaccinated status. So basically, we know that stadiums are opening up. The NFL is having their draft as we speak, and they're talking about having full capacity stadiums next season. A vaccinated person would need to wear a mask in a sports stadium, in a concert venue. But in every other circumstance, for the most part, a vaccinated person can be maskless. Indoors is a little bit more complicated, and I don't know if you want to take the time to go over some of the indoor regulations. They're a little bit cumbersome and tricky. But at the end of the day, for people who are tired of this new normal that want to get back to life, the vaccine's the shortest trip to get there.
So I'm headed to the gym after this webinar, and that's definitely a place where I would need to still mask up, even though I've been vaccinated.
Yes. Yeah.
All right, we have another question from the audience. Question is, for people with underlying conditions, is there any precautions to take before getting the vaccine? Before getting the vaccine?
I would say really just kind of focus on trying to, optimize your health as much as possible. A lot of times you've heard things about, vitamin D, zinc, vitamin C, making sure you get your physical. Those are kind of the biggest things, and really just try to drink more water, try to be as active, more active as possible. I know with the pandemic, different things, it's been a little tough, and trying to get back to it is tough. But I think those are the best things. Try to get as much sleep as you can. But I think those are the biggest thing is, one, not be so afraid to even just get a physical, get a checkup. I mean, I think so many of us are hesitant to, get the truth about what's going on. Like sometimes we always want to wait so long until our health deteriorates so much that we have to go to the emergency room and we got to do, tens of $1,000 workup when some could have been prevented, especially as a primary care physician. So those are kind of the biggest things to not be so afraid and hide and just, power versus being proactive, and reaching out. And that's why I like these kind of forums, because it helps us to kind of despair, fears, and, really letting us know that we're not alone. A lot of us have similar fears, and it's okay to have these. But the more we talk about, the more we dialogue, especially in these type of forums, ultimately we get the point across enough and we can try to turn things around. So
I'd like to add to that. Please go ahead. Yeah.
I want to add on to that comment related to, access to healthcare and the importance of really, utilizing the healthcare system from a wellness perspective. And what we've seen here from a healthcare perspective is because the shutdowns occurred and there was hesitancy previously, we've seen patients who traditionally have waited a lot longer to come into their primary care physician. We're seeing a lot higher percentage of breast cancers that are diagnosed at, stage 3 and stage 4. We're seeing a lot more deaths at home. We're seeing a lot of higher acuity patients who are coming to the hospital and entering the hospital and healthcare system way too late. So although we're still in a pandemic, I strongly encourage everyone to continue to see their primary care physician, to continue to have their recommended screenings and their recommended, follow-up visits, wellness visits, because, we're seeing the true, so we're seeing the pandemic, but there's also the impact of healthcare, delays and actual treatment that took place before the pandemic, but have, really gotten a lot worse based on fear of accessing the system, based on fear of catching COVID. And so hospitals and healthcare organizations are safe. We require our patients to wear masks, our staff to wear masks. A lot of our staff have been vaccinated. And so I think really, going back to the normal as it relates to, preventative care and really focusing on some of the areas that Dr. Berry mentioned are critically important.
If I could just add to address that question as well, I would echo what Dr. Berry said, but I would also add there really is no specific preparation that anyone needs to do before getting the vaccine. One of the questions I get asked is, should I take Motrin before, or should I take Tylenol before, that sort of thing. And actually, the experts suggest that you probably shouldn't do that, only because that's not how it was studied. So we don't know if taking Motrin or Tylenol before would somehow blunt your immune response. We just don't know. So the best recommendation really is to have preferably Tylenol, acetaminophen, available for the aches and pains after you get the vaccine, but taking anything beforehand, probably not something you want to do. There's one exception to what I just said, and that's for the people who are immunocompromised because they have diseases like lupus or rheumatoid arthritis, and sometimes they're getting these antibody sort of treatment injections that happen every month. Those kinds of patients should talk to their rheumatologist before getting the vaccine, not because they're not eligible, but because they may want to delay when they get their other medication with respect to the vaccine, if that makes any sense, so that they're not getting that antibody medication and a vaccine that's going to create antibodies at the same time. And again, for the same reason, we don't know how those are going to work together.
Now, I don't want to end this webinar without asking you guys, how are you doing? I mean, not just physically, but mentally. And you all are on the front lines. And for that, all of us on this webinar, we appreciate and applaud you for that. But can you just briefly tell us, how are you guys doing? How are you?
I think from my perspective, the pandemic has given me an opportunity to really do more inner reflection, to try to learn, new skills, to try to really catch up on things and friends and family that I haven't had the opportunity to catch up with in a while. And I think it really, has forced me to kind of take a step back and live more of a balance, have more of a balanced lifestyle. As healthcare providers and those that provide for others, oftentimes we pour ourselves and have poured ourselves into leading those and working with those patients that are most vulnerable to try to protect them. But for us to really be successful as healthcare leaders, we have to be well ourselves. We have to live by example. We've got to get our cup filled at the same time. And so, doing things like getting back to your normal exercising schedules, connecting personally with friends. I personally, at our facility, we bought the Calm app for our staff, and I've started using the Calm app as a way from a meditation perspective, to help with, getting good sleep and really some of the other offerings from a Calm perspective. And so I would really encourage everyone to focus on their mental health, and use some of the tools that are available, like Calm and other mental health applications, to really, provide some of the opportunities for greater access. We as Americans are used to interacting with people, and so really, continue to have interaction, but using more, teleconferences and more other opportunities to interact, because that's a very important part of living a healthy lifestyle, is having, brain stimulation as well.
What about you, Dr. Berry? And I know you got toddlers running around there. That's a whole other story right there, but how are you doing?
I think overall, doing pretty well, just really trying to keep things in perspective. I think it's so easy to get lost in, how everything is going, especially, it's just one thing after another, then all the other things that are going outside the pandemic, and to get really just kind of, defeated. I think the biggest thing is just really slowed us down and just like look into small things, that the basics that we take for granted every day. And, just kind of sometimes being able to spend time with your family, being able to really kind of do those extra little things that, a lot of times we took for granted. And I think for me, and just kind of my wife as well, just, we tend to try to just, and I think a lot of, providers as well, just really be grateful for the smaller things. It could always be a lot worse. You think about how much things that, frustration that we're dealing with, and really just look at those kind of things to really just truly be grateful. It really, depending on what kind of person you are. I mean, I love sports, music, different things. So really try to like get in those outlets a little more, or really just kind of catch up on that. Trying to exercise a little more. Also doing your daily devotion. That's been a little tough because you haven't been able to go to church and those different things, and really trying to find a way that you could kind of help to relieve otherwise to relieve stress as well. I think that's really important, just like, mental health aspect, and just really trying to get sleep and really just being able to talk to others, and just that's so critical. But overall, we're doing pretty well. I mean, we feel better now having the vaccine than before, but we're still, treating the same way. It's not like, oh, we have the vaccine, so now we can, now we don't have worries, but it's the type of thing where, we all just got to do our part. And I think, that we all feel called, the professions that we do, and it's always bigger than us, and that's kind of, as long as we have the right perspective, then, we can move in the right direction.
Dr. Alexis, I know firsthand that you are experiencing a lot of fatigue and time constraints and that type of thing, because I'm associate publisher and editor-in-chief of Legacy Magazine, and Dr.
Yeah.
Alexis is my official COVID-19 columnist. And so for the last issue, I'm like, where's my column? And Dr. Alexis tells me, I'm just so bogged down. It's too much. I said, well, brother, write about that. That's what people need to hear, what you are going through. All right. You don't know whether you're coming or going some days. And so that's just your reality. And sure enough, you did write about that in your last column.
Yeah, it was that gentle nudge as only you can give. But I mean, quite honestly, I think as doctors, as healthcare professionals, we often kind of put ourselves last and don't take a lot of personal stock in how we're doing and what we need. We kind of take care of everything and everybody else first. And I think, to answer the question, I'm doing well. I'm doing better now that I'm vaccinated. I have really missed. I am very close to my parents. I hadn't hugged or kissed my parents in a year. That was a special evening. When I was able to go visit my vaccinated parents as a vaccinated person and give them a hug and give them a kiss and stay for longer than 10 minutes, because I would literally sit at the door with my mask on, and when 10 minutes, like, gotta go. Just terrified, terrified of making them sick. So doing much, better now from that point of view. I get to see, friends, and, very shortly I'll be seeing family. My sister just got fully vaccinated. She's going to come visit from New York very soon. With her husband, we're going to play some golf, or at least I'm going to pretend to play golf. Things are better now, but it really was tough. And honestly, I'd be remiss if I didn't take the time to talk about the fact that, the people who really bore the brunt of this for sure were our nurses, and specifically the ICU nurses, and they're still not okay. I can tell you that they're still not okay. They're still overworked. They are having a really tough time. And so they deserve really the lion's share of the praise for the care that was rendered throughout this pandemic.
All right, our time is winding down, but I want to squeeze in a couple more questions from the audience. Monica Richardson wants to know, how accurate is the COVID-19 data? She says some of the myth are the numbers. The concern she hears is when speaking with people of color is that medical facilities are labeling everything as COVID-19 in order to obtain more funding for the hospitals. Is this a myth, or is this something that's accurate? Asks Monica Richardson.
I would say from our perspective, the incentives related to COVID-19 are far compared, are lower than actually, having to really have a slowdown in kind of normal operations. From a healthcare perspective, we've seen a tremendous decrease in routine care. One of the major sources of revenue in hospitals is elective surgery. And during the pandemic, most facilities really had to drastically slow down doing elective procedures because of the safety aspects. And so there is little truth to the desire for healthcare systems to want to have more COVID patients. It's actually opposite. We've seen a tremendous increase in our costs based on having to bring in more travel nurses, open up more locations to take care of very acute ill patients. The cost of COVID patients with remdesivir and other high dollar pharmacy medications far drastically exceeds the cost to take care of COVID patients.
Another question from the audience. Andrea Harris wants to know, is there any update and accurate information about COVID vaccine and ties to women's health? Examples, fertility, and etc.
So again, everything is on week to week, month to month basis. But there are studies that were done that were looked at, because as you can imagine, when you study a vaccine in 35,000 patients in one trial and 45,000 in another trial, there are pregnancies that happen, right? And so what they saw was that there appeared to be no impact on fertility. There appeared to be no impact on normal gestation and having a normal pregnancy. But those numbers would be relatively small. It's not a study that looked specifically at that, but based on what we know, there's no reason to believe that there is any connection between diminished fertility and the vaccine.
Brother John Riley wants to know, what are some things we can do to build and strengthen our natural immune system?
Well, definitely, I alluded to some of those things a little bit earlier. I think one thing, just for example, is just kind of understand the immune system. So we know about vitamin C, and vitamin D is one that now people are starting to understand more about, and we're still trying to, kind of explain that more. So vitamin D also helps to ward against viral infections, especially in the lungs. So like the flu, COVID, SARS virus, you name it, all that stuff. But see, vitamin D helps to absorb calcium. Well, we know about that. But a lot of times, depending on how much melanin we have in our skin, so the darker, for example, that you are in complexion, the melanin tends to kind of block some of the absorption that you normally get from the sun, the vitamin D from the sun. So beside that, let's say you could also be lactose intolerant. Let's say you don't really, have a dairy and different other sources of high vitamin D. Well, that also, you see, that can also weaken your immune system and put you at increased risk. So that's why it's really important to make sure you get your vitamin D levels checked. For some reason, some of the different healthcare insurances and whatnot, and make sure you let your providers know that you also want to get the vitamin D checked as well, because sometimes they may want to make you pay out of pocket for it, and it's crazy during this pandemic. You think they would want more people to check that, but those are some of the different things, making sure vitamin D, zinc, and vitamin C, all those basically work to in conjunction to really kind of help try to boost your immune system. But ultimately, I still would recommend getting the vaccine, is even more so.
And if I could add to that, can I just add to that briefly? The other thing is the things that we don't think about much or take for granted. So sleep.
Yeah.
Sleep is critically important. So rest, sleep, exercise, healthy diet. But sleep is the thing that we neglect all the time. I mean, I'm sure that just about everybody on this call has noted that they've gotten sick after they've been burning it at both ends and haven't slept. So that's critically important. I just wanted to add that.
Really good point. Mm-hmm.
Okay. One last question from the audience. Are there any uncommon symptoms of COVID-19 that we need to be aware of? This comes from Brother Avila.
So the answer is yes. I mean, anytime you ask that kind of question about any medical illness, the answer is going to be yes. But specifically to COVID, some people have had GI symptoms, meaning kind of in the stomach and the gut, diarrhea, that sort of thing. But the most common of the uncommon is probably the GI stuff: diarrhea, nausea, vomiting. There are other things that are really weird that I haven't even committed to memory because they're so rare and so weird. But I think the GI is probably the most common of the uncommon stuff.
I would say sometimes some of the weird, I want to say like head and neck. So like losing a sense of taste or losing a sense of smell, those kind of things too, which is kind of odd. All of a sudden that's something that's very kind of different than any other kind of flu-like illness that you get. So that's one of the things. If you're having that, if you're either short of breath, sometimes one of the things we recommend is even just getting something called a pulse oximeter or pulse ox, and what that is, it just it detects the level of oxygen in your finger or your extremities, just to see if that is low as well. Just that's kind of one of the things that we were looking into as well. But those are some of the different things that we can look at. But if you have a weird symptom that you had never had before, especially something like a really weird headache, or really weird, sense of nerve conditions, sense of smell, something that's odd, don't, always always look into this could also possibly COVID. So that's kind of one of the other things as well, real neurologic condition.
All right, we have reached the 1 hour mark. I want to hear some final comments from you, and we'll start with CEO Kenneth Jones. Some final comments.
I want to thank Brother Motley and the other panelists for the opportunity to speak. I think we have to come out of this as a community, and our communities are our families, it's our loved ones, it's those that we take care of, it's those that are vulnerable, it's those healthcare providers, and if we look at this as individual gains, we've lost. We won't be successful. We have to look at this from a community perspective and really continue to spread the word on the benefits of the vaccine as well as healthier lifestyles. Those kind of work in tandem as it relates to our success. And so I encourage everyone to continue to spread the word. This is a marathon, not a sprint. And God bless. Thank you.
Dr. Berry?
Yeah, I piggyback a lot with Kenneth and Jones said. Same thing here. I mean, I just think that this is definitely bigger than us. Really just trying to spread the word as much as possible, lead by example, never be too, and just always, just like how Dr. Alexis was saying, really, putting yourself out there and really explaining, why if I had to do it all over again, I still would. And just letting people know that, it's okay to have fears about certain things, but really our job at dispelling that and really explaining how the benefits of this vaccine can outweigh these risks, especially rolling the dice with these rare, I guess, either symptoms or long-term complications. And then we also don't know how long that you may have that complication going on for. That's even scarier, just to think that could occur. So I think that's one of the biggest things we need to drive home. And I think one of the other biggest things are also, the vaccine decreases the viral load overall, but doesn't prevent, and also helps to prevent severe disease. So that's kind of the biggest thing that, you want to look into is that, you still could possibly be able to catch it. Let's say you've gotten vaccinated, but you got to think about, that you might not have symptoms, but you still may, allow you to, transfer it to, somebody who hasn't had the vaccine. So it's more important to, definitely still, get that, because you're going to prevent, you're really going to lower that risk of severe disease where you may be able to fight it off either at home or not have those kind of symptoms. So that's kind of one of the biggest things that we got to look at as well. So, yeah.
And Dr. Alexis?
I would echo everything that was said. A special thank you to everybody that took time out to participate. I think we're competing with the NFL draft. So I really do appreciate that folks found this important enough. I think the most important message I'd like to send is that if you've been vaccinated, please don't be quiet about it. Be an example, be verbal about it, be vocal about it. Make sure people know what your experience was so that they can follow suit, because to get out of this, we really do need to achieve herd immunity. And there are really two ways to get there: get infected or get vaccinated. I don't recommend getting infected. I think this is a great opportunity to take care of ourselves, make sure that we're doing things to take care of our health. This would be an opportunity to show you for more information. I put this up specifically because one of the most frustrating things for me has been the amount of misinformation that's been out there.
Yes.
I mean, I can't go a half a day without getting some 15-minute video sent to me via WhatsApp on some expert who is talking about something that has never been described and never been validated. And unfortunately, that information circulates much faster and much more, and has much deeper penetration into our social media than actual factual information. So I really encourage everybody, get their information from trustworthy sources. Those would be your healthcare providers and sites like this. For example, cdc.gov, they update their data on a daily basis. Everything you want to know about the changes to the guidelines is there. COVID Act Now will tell you exactly what's going on with the pandemic down to your zip code. the vaccine finder, Get Vaccinated, My Vaccine. Those are all things you can avail yourself of to get vaccinated. So that's really all I would say. Thank you so much. I'm humbled by the amount of interest. Thank you for your attention.
Very good, very good. Thank you, Dr. Alexis. And this has been a very enlightening hour of learning why people of color should be vaccinated. COVID-19 is clearly not going down without a fight. That said, it is going to take all of us to keep up the good work, protect ourselves and our families. So until every last one of us is safe, let's keep up this fight. And just remember, getting vaccinated is the key to getting life back to what it was before. Thanks for joining us.
Thank you. Good night.
Thank you, guys.